Okay, now, next group are the concave shape pulses. Okay, everybody is gonna get easier from now on. The hard part's over.
Yeah, the concave condition is just opposite to the convex, so it's not nothing too bad, too difficult. After that we've been through all day till now, you can easily understand this, right? The two springs good. This spring is broke, so they collapse in the middle. So most of the time you will find that your middle finger will fit in this hole here. You feel like this one is just collapse. And sometimes for skinny people, you can see this area is collapsed. It's low. It's concave. Like here. You check your herbal. What's a herbal? Li4. See, you hold your hand normally like this. How is your herbal? Is convex or concave, or normal, or the reaction, the feeling can be very strong, right? You push it so hard. Do you have any feeling?
It's concave.
There are some certain people that they don't feel anything. No matter how hard you push down a herbal, they don't feel anything. Even for a strong guy like 30 years old or something, they have no feeling on the herbal. Do you know the herbal? Supposed to be very sensitive, right? Yeah. And painful. They don't feel anything. And why? Because their herbal area is concave. It collapses. How's your herbal?
I have tenderness.
Yeah, it's okay. Not too good, not too bad. Yeah, this one is better. They're weak. That's fine. So if what I'm saying is, if the herbal is convex, it's good. Too much fire, maybe. It's concave, then it's weak. You have a weak colon. So you can try your patient, your friends or whatever. Hey, do you feel anything? Sometimes they don't feel anything. That means a bad digestion. Okay, so that's why that's the meaning of the condition concave. That's dead. Not dead. No good. Okay? 下一个.
Usually found on the guan positions, left and right side. Okay? And concave and deep are not the same. Okay, everybody? Concave is a shape. Deep is a
level.
What? Level.
It's perfect.
Okay? So concave means you can feel the sides of the vessel going down. So on the right side, the diagnosis is superficial gastritis. On the left side here are different diagnoses.
Yeah, this is the fatty liver. The concave and deep, this is on the left guan. So you have a lot of things to say to your patient. What I'm trying to do is, whenever I take a pulse, I face a patient, I just keep on saying it. For the left guan, if they have the concave, the pulse like this, the graph is on the first page, you can say fatty liver. There are many things, okay? First, hey, you have fatty liver, no matter you drink or not. Second, this is the pulse for anxiety and depression. You can tell you have depression and anxiety, okay? You don't let them talk. You just keep on saying. And thirdly, is the dampness in the liver. That's not liver. In the gallbladder area. That means that the inner ears is out of balance with some fluid inside, like a Meniere syndrome. Hey, you have some dizziness, some vertigo too. And the fourth, hey, you're very tired and all the time, and anxious and nervous and have no energy and dizzy and fatty.
What kind of symptoms are in fatty liver?
No, there's no symptoms. None at all. Anxiety is a symptom. Fatty liver, you don't feel anything at all. But they all know. I tell you, they all already know, because there must be some blood test will show them. A doctor will tell them too. And the concave and weak, that's definitely, hey, you're so tired. this guy is so tired. Maybe he needs help with the energy. If the major complaint is being fatigued. So that's why at the final stage of my diagnosis stuff, I always ask, what do you want me to do? So I wrote down their request. Sometimes what they hate the most, that is when they went back and they called me and said, hey, doctor, what's the medicine was for? I told you I'm doing this for you. You ask me what it's for. I hate it most. So sometimes they refuse to answer. Why do you treat me all? I always ask them, give me a target. What do you want me to do? Your head, your energy, or whatever. Give me a target that I can focus. So I can focus on it. So we can evaluate condition next week. Don't give me those blurry answers. Concave and birth picking the pain, this gallstone, maybe just call temporarily some spasm of the bile duct or something, but definitely they will have some kind of pain here. I have many Mexican patients. Most of them have this. They have pain on the right, under the right rib area, and that can be treated easily. But actually, it's not that easy because treatment is fine, but their living style, the things they eat, the way they live is difficult. It will cause more problem. No burritos. The way the Mexican people eat is funny. They give them very, very strong reproductive systems. They all have big ovaries. Big. Huge. So I ask, how many kids you have? 5. Yeah. That area is the ovary. It's big. For men, it's testicle.
He always says that. He says, when I have Mexican patient, I look at their ear, I tell them, you have big balls.
I don't use the word balls. Come on. I don't say balls.
Oh, are you jealous? He says.
Huh?
Just kidding.
I said the testicles.
Oh, testicles. Oh, you use the technical term? Okay.
Yeah. For female, it's the ovary. The bigger, the better. Okay.
Okay, back to class.
Concave.
Okay.
Okay. Let's leave this. Oh, this is no. It's forceful pulse at the bottom of the curvature. Wiry has to be blade, thin and wiry to be cirrhosis. So the pulse, after you're familiar with the pulse signs, then naturally you can tell how to treat it. You don't have to. Sometimes we don't understand the signs or the terms of the problem. The patient always like to ask me, hey, I've been diagnosed as something. Do you know that? I always tell them, no, I don't. Never heard of it. Not only here in Taiwan. If they ask me something, I said, no, never heard of it. Find somebody else. But actually, I was kidding. Sometimes we don't know the term. They got funny names for everything. I don't care. I just know that all I have to know the nature of the problem according to our findings, and we do it oppositely and mechanically. If they're up, we bring it down. They're down, we bring it up. They're weak, we make it strong. They're too strong, we make it weak.
Okay, so we're going to skip the herbs because we wrote it all out for you. We'll just go straight to the next category, which are it's another group of shape pulses, but this is just totally shapeless.